noticed Zachary's frustration levels, and therefore his behaviors had dramatically decreased. A simple thing like wanting a glass of water and us not being able to guess what he wanted would lead to hours of screaming, crying, and banging his head on the floor. By 6 months in, we were able to teach a still fully nonverbal child how to use the bathroom, amongst other various necessary life and educational skills. No one harmed him, withheld his treasured objects, or food or drink from him in order to teach him these things, a common misconception when speaking about ABA therapy. Proper ABA therapy provided by a competent, well-trained, respectful provider can mean a world of difference in the life of a child with moderate to severe autism, and in Zach's case, it was a complete game changer. It's true that Zachary's early therapy and education cost somewhere in the ballpark of $100,000 US per year in those early years. But as the years have gone on and he has grown and improved and subsequently moved on from many of those costly therapies, that number has drastically decreased. My husband and I have never paid a single dime out of pocket for any of these services, nor has our private health insurance ever been utilized to fund such therapies. I know there are many who would say, well, it's not my child, so why is it my problem? I'm going to tell you why New York State invests so much into early intervention, not just for children with autism, but for any child with any disability impacting their ability to live their fullest life. It is because investing in needs-based therapy in a child's formative years has proven to cost on average 2/3 less over the course of their lifetime. The cost to feed and house and care for a child like Zach in a group home during his adult years is astronomical. And with the rising costs of everything currently, those figures will continue to go up. When that child's parents are too old, too sick, or they die and aren't able to care for their disabled children, their care falls to the government and ultimately the taxpayer. It saddens me to know how many children are languishing on never-ending wait lists, waiting for money that is a mere drop in the bucket compared to what Zach received. So many of those children age out before they ever receive the full funding. Zach is 13 now. ABA therapy ended when he was 5. He had gained so many necessary skills in just 2 short years, it was no longer necessary. He no longer receives physical therapy for his low muscle tone. We just recently ended his occupational therapy services since his fine and gross motor skills are better than some adults I know. He still receives speech therapy, but at a slightly reduced rate. He no longer utilizes the PECS picture system as he can speak well enough to get his basic needs and wants met and continues to improve in his conversational abilities. Zach is on track to move up from a 611 self-contained classroom to a 1211 self-contained classroom. And at this point, I have every confidence that he will one day be able to live independently with some supports in place. Ontario, you have failed an entire generation of our most vulnerable children. They deserved better. Their parents deserved better. At this point, you're on your way to yet another generation of children being failed by a garbage system that is so tied up in red tape that very few seem to be able to navigate it timely or successfully. How we treat our most vulnerable in society is a reflection of that society itself. It saddens me to see that my homeland and my home province of Ontario, my own child is not considered a person worthy of help and support to live his best life to the fullest. Had we not moved when we did, Zach would not be the happy-go-lucky kid who continues to grow and improve every day. Zach would have been destined for a group home life the minute his father and I could no longer care for him. That's not the life I want for my child, and it's not the life I want for my fellow Ontarians' children. The bottom line is pay now or pay later, but I implore you to do the right thing. Cut the wait lists, cut the red tape, and invest in our children now before it's too late. These kids deserve better than a third world country response to their significant needs. Thank you so much.
We'll take any questions if anybody has anything.
You said you're worried, you're irritated by the amount of tinkering going on by the government. It slows things down, but are you at all worried that moving of the program from one ministry to the other is just going to cause even more delays?
No, not really, because if you look at the Ontario Autism Program, when it was first put into place back in 2000, it's been changed 7 or 8 times. The Ministry of Children, Community and Social Service, they don't have the resources or the expertise to deal with a healthcare issue. Take a look at it this way. You have families in Northern Ontario who driving for hours to get treatment for services. Well, why not put it in a hospital? to get that treatment. You have to look at the ballpark figure of this whole situation. Like, I'll give you another example. When my son was diagnosed with autism, I took him to the service provider, Aaron Oaks, when he was at the age of 4. And they told me that my son was not ready for ABA. That's what they told me. I said, well, this is a healthcare issue. The science has proven, since the 1980s, that early intervention is the key. So a year later, we went back and they said, oh, your son is ready now. And then when we did our assessment, they said, well, we're only giving you 12 hours. But here it is, when you look at the science behind it, you realize that, okay, 12 hours is not enough to get these individuals, children, to adapt to society. So by having into the Ministry of Children and Community Social Service, I mean, it's just a disaster. Think about it this way. Just imagine having cancer into the Ministry of Transportation. I mean, I don't think that would go well with the Cancer Society of Canada. You're having in a ministry that doesn't deal with a healthcare issue. So, next year, the board certified behavior analysis, they've been recognized by the College of Psychologists. And actually, July of next year, they'll be in there. So what a perfect opportunity to give OHIP coverage for children with autism treatment, So no, we're not worried about that at all. It should be in the Ministry of Health, because at the end of the day, autism is a Ministry of Health issue. Autism treatment is medically necessary, and people should be using their health cards, That's pretty much it, yeah.
If I'm understanding you correctly, the idea is that as a social service, there can be wait lists and limits and budgets with caps, but if it was a healthcare, it would be based completely on need and it would cost whatever it costs to get it done. Is that what you're saying?
Yeah, absolutely. There's one thing that we as Canadians, we take pride in. We take pride in our public funded healthcare system. This is what we take pride in. 1/3 of our taxes goes towards healthcare. But yet, families are not getting that health care they need. We also have a tendency here in Canada to point the finger at the Americans and say how life is far much better here. Well, I can honestly tell you this. If you're autistic, that is clearly not true. In the United States of America, they actually have laws that protect autistic people in healthcare and education. And even the United States of America, the USA Surgeon General, the chief medical officer, has even stated that autism treatment is medically necessary and that ABA is the golden standard treatment. Board certified behavior analysis are recognized down there as health practitioners. In all 50 states, autism treatment is covered under their health insurance plan. But we have a premier here who seems to think it's a Ministry of Children and Community Social Service issue. And, he always talks about, we're the only government that's paid this amount of money. Okay, well, that's fine, Doug. But what about the other 40, 60,000 kids? Don't they need a chance in life? I met Premier Ford this summer, and I said to him politely, I said, Premier Ford, I said, you guys just negotiated a deal with the Federal Minister of Health for money for new health accords. I said, what a perfect opportunity for you, sir, to say, hey, what about autism treatment? You know what he says to me? Oh, let me direct you over to our new minister. He's a great guy. Parsa.
All right, we've been listening live to this press conference from Queen's Park. That's the Canadian Autism Treatment for Medicare Coalition. They believe that autism treatment should be covered by OHIP, but they're talking about the fact that it now falls under a different minister's responsibility, the autism program, that is.